Hello everyone, welcome back to my channel. So today we are going to talk about a case of dense posterior subcapsular cataract with a mature cataract of grade nuclear sclerosis grade 4. And sometimes this type of cataract is also known as pseudopolar because the posterior capsule may be compromised in these cases or slightly weaker than normal. So let's start with the discussion. So after initial steps like side port and main port and staining of the anterior capsule is done, capsulorhexis is started with the cystitome, and my aim for the capsular opening is around at least 5.5 millimeter because the nuclear sclerosis is grade 4, which is harder than the usual, and there is a dense posterior subcapsular component, so it would be better for handling the nucleus. Now the main port is made after completion. Now the gentle hydro-delineation will be done, and I will be doing this very gently, and I am trying to avoid inadvertent hydro-dissection. So instead of hydro-dissection, I will be doing manual dissection with the help of long blunt tip chopper. So I will be doing sweeping movement under the anterior capsule in 360 degree. So I am trying to separate it. I am trying to separate the cortical metal from the anterior capsule and make a nucleus freely mobile. And this maneuver will keep the anterior chamber formed and avoid fluctuation in the posterior capsule, which may lead to PCR. Now I can see that the nucleus is rotating very well, and visco is injected into the anterior chamber, which is followed by the emulsification of nucleus. And for emulsification, I will be doing my classical direct chop technique. The center of the nucleus is embedded with the help of phaco tip, and the first chop is done, which seems to be incomplete, but it will suffice the purpose. Now it is then rotated 90 degree. Second chop is done, it is again rotated, and the complete separation of hemisphere is done. The 4 pieces are further chopped into triple small pieces. I can see the round central core, cataractus core, which is emulsified and aspirated. Now each piece of the nucleus is aspirated one by one. Throughout the emulsification and procedure, you need to remember that the EC fluctuation should be minimized, and it will prevent the chances of posterior capsular rupture, because I am assuming that PC is already compromised in this case. Now the epinucleus is also aspirated. Now you can see the central clear zone from which the adenate plaque has been removed. I have put the visco from my left hand before taking out the phaco probe, so that the anterior chamber does not collapse. Now it's time to do irrigation and aspiration. So I am using bimanual system of IA and stripping the cortex very gently in a tangential manner. And I am keeping a fact in my mind that anterior chamber should not be collapsed while switching my hands. So the visco is injected before taking out my irrigation cannula. Now the hands are switched and other side of the cortex is also aspirated. Cortex aspiration is almost done. Now I will be doing hydro-implantation. Although in case of posterior polar cataract, hydro-implantation is avoided, but I will be very gently putting the IOL into the bag. And remaining visco is also taken out. Now the stromal hydration is done and the case is completed. Thank you for watching the video.